I'm in Professor Hayes' class, and I'm going to do a demonstration of maintenance of a PEG feeding tube. So the first thing that I'm going to do is check the doctor's orders. I am going to wash my hands. I'm going to introduce myself to the patient, check the patient's ID. I'm going to explain the procedure that's going to be done. I'm going to gather my equipment, and I'm going to provide for privacy. So after washing my hands, I'm going to put on my gloves. And I'm going to raise the bed where I come to reach a comfortable working position. And I'm going to raise the head of the bed at around 45 degrees. I am going to stop the feeding pump, and I'm going to assess the patient for nausea, abdominal distension, and I'm going to check bowel sounds, for bowel sounds, I'm sorry. So there is no abdominal distension. He is not nauseous. So now I'm just checking for bowel sounds. Bowel sounds are audible, and the patient seems okay. So I'm just gonna put the pad. The pump is already stopped. I am going to kink the feeding tube and disconnect it. I'm going to take my syringe. I'm going to unkink the feeding tube and aspirate. If the content, the residual content, is more than 100 mLs, I'm going to stop the feeding and I'm going to call the physician. If it's not more than 100 mLs, if it's less, I am just going to check for color, consistency, and amount, and I'm going to reinstill the residual. I'm going to kink the feeding tube again, and I'm just going to take 30 mLs of tap water, unkink the tube, and proceed to flush the feeding tube. Kink it again. Connect the feeding tube. I have to connect the pump again, check if the bag has to be replaced or not, and of course we have to change the whole system every 24 hours. I'm going to gather all my equipment. I'm going to leave the patient in a comfortable position. I'm going to give him the call bell just in case he needs me for anything. As I said, I'm gathering all my equipment, and I'm going to wash it and put it for the next time I need to use it. I am going to take off my gloves, wash my hands, and record INO and document INO. And I'm going to lower the bed to the lowest position and just let the patient know that anything he needs, he can give me a call. That ends my demonstration.